Thank you so much for the kind introduction. It is such an honor to be here. You all are responsible for treating glaucoma in people. I'm responsible for treating glaucoma in every other animal on the planet. N-1 species, from cockatoos to dogs that we'll talk about quite a bit today. So this is a typical patient that presents to our ophthalmology service. This is Scout, a 2-year-old castrated male Labrador retriever. By the time an owner notices a problem in a dog, we can see that and it's usually due to a color change. Here we can see the cornea is edematous, the pupil is mydriatic, and when we do vision testing in this eye, the patient is already blind. So we see end-stage glaucoma often as at the initial visit. So that's a big challenge for us. In terms of our differential considerations, by far we see primary angle closure glaucoma most commonly in our patients. POEG is much more rare. There is an excellent model available, and we'll discuss that in a little more detail in a little bit. We also see causes of secondary glaucoma, such as uveitis, that we can see in this image here. And then rarely we see congenital glaucoma, and we can see the severe buphthalmos in that puppy as a result of congenital glaucoma. When we, unfortunately, Scout, due to the severity of the glaucoma, actually needed his eye removed. And so we're going to talk about the histopathology that we would see. First, I want to orient you to the normal iridocorneal angle of a dog, where we can see a nice open uveal and corneoscleral trabecular meshwork and the tortuous angular aqueous plexus. Dogs don't have a Schlemm's canal like we do. And so that basically eliminates all the types of surgeries along those lines. When we looked at Scout's eyes, I want to acknowledge the Comparative Ocular Pathology Laboratory of Wisconsin. They have the largest collection of animal eyes in the world, I think over thousands and thousands counting. And so we can see that the complete collapse of the iridocorneal angle and the ciliary cleft here. And we can see how Descemet's membrane tapers and contacts that iridocorneal tissue. So they diagnosed Scout with acute on chronic glaucoma associated with goniodysgenesis. And this, due to the young onset of this dog, actually had a form of anterior segment dysgenesis. So a little more about canine primary angle closure glaucoma. It's much more common, as we discussed. Initially, we would see a unilateral rapid marked increase in IOP. When Scout presented, the intraocular pressure was 62. And just a few months later, we expect the fellow eye to have its initial glaucomatous event. The mean time to that is about 8 months. In terms of pathogenesis, a major risk factor is pectinate ligament dysplasia. And you can see in the image a nice normal iridocorneal angle and pectinate ligament. In a dog, you can see it's heavily pigmented, so it looks a little different than when you do gonioscopy. But with pectinate ligament dysplasia, look at that sheet of iris-like tissue that's covering the iridocorneal angle, and you can just see little flow holes. So this is a nice example of goniodysgenesis. In terms of diagnostic testing, we're going to do intraocular pressures. We can't do Humphrey visual fields. That would be very difficult. But we can test, we can use maze tests and other different ways. We can cover one eye and maze test an animal. We can use a laser pointer. That's really helpful for cats in assessing their vision. So we don't have the same types of tests. It's a little more challenging, but of course, vision testing is important to us as well. In terms of imaging our glaucoma patients, we're often going to do gonioscopy, and we can see again that normal drainage angle on gonioscopy of a dog on the top, and look at Scout's completely closed iridocorneal angle on the bottom. We also do high-frequency ultrasound, and so we can see on the top, we can see a normal ciliary cleft here. We can see normal iridolenticular contact. But Scout, we can see, has this completely collapsed ciliary cleft, severe iridolenticular touch, and iris thickening. So some definite changes in the biometry of this eye. So dogs really are an excellent model of angle closure glaucoma. We published this study 2 years ago that looked at Cocker Spaniels. Anybody have a Cocker Spaniel in the audience? Okay, good. Oh, okay. Oh, sorry. Bad news. They're at high risk. They're probably the poster child of glaucoma patients. So the most common breed that we're going to see. So that's sorry, James. Bad news. Hopefully your dog doesn't get it. And so in this study, we first wanted to see if there was a genetic risk factor for the disease. So we did a genome-wide association study and did not find a significant loci. So then what we did was compared this high-risk glaucoma breed, normal Cocker Spaniels, with normal Beagles, which are a breed we really don't recognize with angle closure glaucoma. And we can see that the anterior chamber depth was significantly decreased, as well as the ciliary cleft area. In addition, we're seeing this increased iridolenticular contact and iris deflection. So we can see the morphology is quite different in the Cocker Spaniels. Unfortunately, that may mean that every Cocker Spaniel, to a degree, is at risk for glaucoma, but this is an excellent model for angle closure that we can utilize. There are also dogs with Adams 10 mutations that serve as excellent open-angle glaucoma models. And if you're interested in dogs, then I would highly recommend you contact Andras Kamarmi. In this paper, he described a new breed of dog, the Norwegian elk hound, having this Adams T10 missense mutation in the metalloproteinase region. And so not only are Norwegian Norwegian elk hounds available, but he has a colony of beagles with this condition. And these Adams 10 mutant dogs can be used to test novel treatments. All of the, or much of the preclinical work on prostaglandins were done in these glaucomatous beagles. And here we can see the rocklatan drug and how its treatment with it in comparison to latanoprost. And so dogs, while they are useful models, we can see that the dog responds very well to the prostaglandin. It does not respond to rocklatan, which is a combination of nitarsil and latanoprost. I also want to direct you to the images of dogs post-prostaglandin. You can see that they get extremely severe meiosis. Now, for us, that may be very, very helpful in our angle closure glaucoma patients because we can break that pupillary block. But unfortunately, it means that dogs have some limitations, that their biology of their iris and their ciliary body and perhaps and also their trabecular meshwork may differ in comparison to people. And so I'm privileged to run the Vision Sciences Laboratory at the California National Primate Research Center. I hope that you can recognize much of the equipment that you use on a daily basis. We have a Heidelberg Spectralis, an Oculus Pentacam, fundus photography, slit lamp biomicroscopy, pretty much everything that you utilize in clinic we can do in primates. And I always teach my trainees on primates because I'm like, well, their face is just like a person, whereas imaging dogs is a lot more difficult than a person in terms of their facial morphology. Some of the first studies I did were in Boston Terriers because they had a flat face and their eyes were very forward-facing. There's no dog that looks more like a person than a Boston Terrier. All right, and so I just wanted to just let you know that, of course, the experimental glaucoma model that Brad Fortune mentioned in his research with laser-induced glaucoma is absolutely the gold standard. But there are other models of ocular hypertension we did a pilot study looking at, and this is I apologize that the title is cut off. It should say a non-human primate model of steroid-induced ocular hypertension. In this small pilot study, we administered triamcinolone and then looked at intraocular pressure, as well as we measured the stiffness of the tissue with atomic force microscopy, and then did proteomic and microRNA analysis. And we could see that in this small pilot study, we were able to observe an increase in intraocular pressure in one animal, and that animal also had a stiffer trabecular meshwork. When we looked at the proteomic analysis in all 3 primates, we observed changes in extracellular matrix as well as cytoskeletal rearrangement. We also have discovered a non-human primate model of autosomal dominant optic atrophy. This was using a gene-forward approach, and we can see the marked optic nerve atrophy and thinning of the circumpapillary RNFL in this animal. As you know, autosomal dominant optic atrophy is one of the most common inherited optic neuropathies. It causes optic nerve degeneration, and there are many features similar to glaucoma. We found that the OPA1A8S mutation, which is an analogous mutation to that of people with the condition, is common at our primate center. We can first observe disease in about 7 years of age in both terms of structural loss and decreased function. And we have noticed that the OPA1 homozygotes exhibit disease at a much earlier age. We can see RNFL loss and reduced function using multifocal ERG, thanks to Dr. Brad Fortune, in one of the homozygotes. Our breeding formations have now produced several more homozygotes in which we can study neuroprotective therapies without having to worry about changes in IOP. I want to thank, it takes a village to do this research, so I want to thank them as well as the funding sources, and I'm happy to entertain questions.